Wellness for Life is brought to you by Back in Motion Physical Therapy, Gothenburg Chiropractic Clinic, Mahabi Atwa Community Action Partnership, Lakeside Sports and Pain Clinic, and Thomason, Swanson, and Zahn Attorneys at Law.
We're with Jen Soul, the Early Childhood Services Director at Mahabi Atwa Head Start, and we're actually, Jen, in the DL Home Base Head Start room, which is a fantastic room full of lots of things to look at and play with. But let's talk a little bit about Head Start, Jen. What is Head Start, and you know, who are some of the families that you're serving here?
Sure. We, Mahabi Atwa, we serve 5 counties, and we serve Mahnomen, Becker, and Hubbard County, as well as Ottertail and Wadena counties. That's where our name comes from. And Head Start is a comprehensive services program, and we serve pregnant moms and children birth to age 5 in all the counties.
So if you're looking to get a child enrolled in Head Start, what is the process, and how do you qualify for Head Start?
The first thing we ask people to do is go to our website. There's an application right online, and they can apply right there. If families have been with us before, they'll get a message that says to call our office, and we set up an enrollment interview. And each child that applies, we do a whole application process, and our program is a point-based system. So we are required by the federal government to serve the children with the highest needs or the highest at risk. And so we assign points for various things, everything from their income to whether a child is in foster care or has developmental delays, or even if there might be delays that people are worried about, we give them extra points for that.
Sure. So what, you know, when you've got families, you've got kids that you're serving in Head Start, what are some of the benefits of Head Start and some of the reasons why Mahabi Atwa is finding the financial resources to put something like this together?
So like I said, we're a comprehensive program. So we don't just work with the children, even though that's a really big part of our program. We work on the educational, the developmental aspects of the child. We also work with the whole family. And so we're working with family services, getting families connected to what they need. Sometimes it's employment, sometimes it's going back to school or getting the resources that they need to be better parents. We also work with the health, mental health, and disabilities pieces of child development.
We talk a little bit about applying, and you're currently enrolling for the fall already for Head Start.
Yep, we are. So our programming, some of our programs go year-round, and we're finishing out our 17-18 program year right now. And then in August, we start our new year, our new program year. So we're taking applications. We do have 3 different types of programming. We've got center-based programming for children 6 weeks up to age 5. And then we have home-based programming for children, for pregnant moms and children birth to age 3. And that's in 3 of our counties. Home base is in Becker, Mahnomen, and Hubbard counties. And then we have family child care, and that's for children 6 weeks up to 5 years old, and that's available in all 5 of our counties.
Sure. Well, we're in the DL home base right now, and like I mentioned, there's just a lot to look at and a lot to play with. So what does the average day look like for somebody that's here?
Well, one might say it's just full of play. If you were an outsider looking in, you'd think the kids are just playing, but they're actually learning and growing their brains, and we're preparing them for kindergarten. So all the way, like I said, pregnant moms, we work on healthy prenatal options, and then from birth all the way up till they're ready for kindergarten.
Sure. Wonderful thing that you're doing here at Head Start in Mahabi Atwa, the communities and the counties that you serve. If someone's looking to enroll for fall, where would they go to do that?
Go to www.mahabi.org or call our office.
All right. Well, thank you so much, Jen. We're at the DL home base with Head Start, and all part of Mahabi Atwa.
Coming up on Wellness for Life.
Hi, Dr. Mark Wheaton back here with you again to discuss some of the common things that we can treat with prolotherapy. I'm physician owner at Lakeside Sports and Pain Clinic in Excelsior, Minnesota, and also here in Monaga. So a couple of the common things that prolotherapy treats, one of which is migraines. We hear that diagnosis a lot, and that's a very, very vague diagnosis in many cases. And there's one cause of migraine headaches that occurs that originates in the neck, and it triggers migraines. So oftentimes a doctor or neurologist will say your migraines need a medication or a drug to effectively treat the pain. And in some cases that may help a lot. But if the doctor has not looked at your neck structure and realizes that the neck is unstable and it's affecting the autonomic nervous system that will effectively hold the neck in place, then we'll get to the point where a person will start to develop headaches. They'll transfer into the head and will be manifested as migraines, or even tension headaches, which is another variation on that. So the way to treat that then is by doing prolotherapy in the neck, and this is a treatment process that will involve just injecting a very common substance like dextrose and along the ligaments of the neck, and over the course of time a stabilization effect will occur and the headaches will be relieved. So think about prolotherapy when it comes to treating your headaches and your migraines. Another common problem that people come in for is TMJ syndrome. TMJ is a term that's short for temporomandibular joint dysfunction. And what that really is pain in the jaw. So right where the jaw hinges, right here, the pain is often very severe and affects people's ability to chew or even talk, and can be throbbing and constant pain. So at that little hinge, there is a capsular ligament that holds it together, and when that's loose or has been stretched or injured, it can have or cause severe pain that often results in headaches, or it can radiate throughout the face and the jaw. So prolotherapy can simply, in a small area, cause that ligament and capsular structure to heal, strengthening it, holding it in place, and effectively relieving the pain that occurs with the TMJ syndrome. So a person can completely avoid dental appliances by the use of prolotherapy or other more invasive treatments. In some cases, having your TMJ replaced with surgery. Prolotherapy can be the simple answer to fixing that problem. So also, let's look at a couple of less commonly understood problems that can be treated by prolotherapy. Now, one wouldn't think that post-pregnancy pain or pelvic pain could be treated with prolotherapy, but I see many women who have had a pregnancy and a birth, and because of the normal recovery process from the birth doesn't occur, they wonder, why am I having pain after everything went so well with the pregnancy? Well, in these cases, it's often that the ligaments have not re-tightened as they normally would, because during the pregnancy process they loosen naturally in preparation for the birth. So when that happens, the person can have chronic pain in the pelvic floor region or in the back, sacroiliac joints, and so on. So the natural treatment for this can be simply using prolotherapy to strengthen those ligaments and tighten up the pelvic floor. Some cases it can improve stress incontinence, but in either case the pain can be effectively treated and fixed by the use of prolotherapy in that area. And the same goes for the low back, which is a very common source of pain post-pregnancy as well. So there are many other conditions that I'd like to talk about at a future time, but I just wanted to touch on a couple of these common ones, and one that you may not think about as being amenable to prolotherapy. So for today, though, I'd like to just conclude by saying, if you have any of these problems or any other joint problems from head to toe, don't forget to give us a call at Lakeside Sports and Pain Clinic at 952-593-0500, or look at my website, drmarkwheaton.com, and come on in to see if you might be a candidate for prolotherapy and get that long-term relief of pain that you have been missing so far.
Thank you for watching Wellness for Life. Brought to you by Back in Motion Physical Therapy, Gothenburg Chiropractic Clinic, Mahabi Ottawa Community Action Partnership, Lakeside Sports and Pain Clinic, and Thomason, Swanson & Zahn Attorneys at Law.